Today I am reading from the book Spirit of Homeopathy, big book written by Dr.Rajan Sankaran, philosophy part, chapter number 9, central disturbance. Vital to developing the homeopathic vision is the understanding of what is to be cured in the disease. It is to be able to perceive, to feel and know as the truth that disease is not something local but a disturbance of the whole being. It is to have the unshakable conviction that if we treat the disturbance at the center, the local problem will be lessened. It is to understand that remedy in potency produce the central disturbance alone. These points need to be stressed, repeatedly explained and exemplified so that they become a part of our thought process. This and only this conviction can make us staunch and successful homeopath and remove from our mind the confusion that arises in practice. This vision will make several things clear, and the rules and principle of homeopathy will become absolutely logical derivatives and no longer the dogmas. Questions that about the importance of mind, the difference in the various approach to totality, the evolution of the symptom, the importance of the pathology, the site of the action of the remedy, selection of potency, and the prognosis of all cases. All these questions will be solved quite easily once the vision develops. It is for this reason that I am writing this chapter. We are going to examine the very same idea as in the previous chapter, but this time from a new angle, namely through observation in the practice. We are to begin with one Hahnemann's most profound observation, which he mentioned in aphorism 211 of the Organon, namely that the mental state often chiefly determines the choice of remedy. We are going to examine what this mental state means. We are going to talk about the peculiar and characteristic symptoms and how they too represent the central disturbance. We will see the oneness of Kant's Bogart's and von Ingersoll's philosophy. We will use case illustrations to bring home all we have said. Under the label mental state, not mental symptom. Aphorism 211 from the Organon reads, this hold good to such an extent that the state of the disposition of the patient chiefly determines the selection of the homeopathic remedy as being a decidedly characteristic symptom which can list of all remain concealed from the accurately observed physician. Look at the word. It says the state of disposition, the state and not the symptom. Hahnemann did not write this holds true to such an extent that the mental symptom determines the choice of remedy. Try to understand. He did not ask us to record the symptom. He asked to understand the state of the patient's mind. Don't write contradiction, intolerance of or the dictatorial. These are the mere symptom. Understand the state of mind from which the symptoms comes and develop. If you look at the symptoms, you will be lead to many remedies, but if you look at the state, there will be only one. Now under the label, every remedy has a different state of disposition. In aphorism 212, the creator of the therapeutics agent has also had particular regard to this main feature of all diseases, the altered state of the disposition and mind. For there is no powerful medicinal substance in the world which does not very notably alter the state of disposition and the mind in the healthy individual who tastes it, and every medicine does so in the different manner. Each remedy has a particular state of mind which is characteristic to it. Each remedy produces a state. Each patient has a state of mind. If you compare symptom, you will be lost in the jungle. If you understand the state, you will find that there is only one remedy which produces the state. Aphorism 211 says, the state of disposition being characteristic which can list of all the remain concealed from the accurately observed physician. Look at the world. We say mental symptoms are most difficult to get. And animals say it can list of remain concealed from the whom? From the accurately observed physician. The world observing, if you are able to observe, no patient can hide his mental state from you. He never wrote, I can list of remaining hidden from the accurately inquired physician. The physician is an observer. Mental state has to be found mainly by observation and not by the inquiry. You have to look, you have to see, you have to understand, and you have to feel the state, feel the state of the patient. You have to experience the experience of the patient. This is the art of case taking. Especially with the mental symptom, it is not just asking question, are you angry, are you sad, are you depressed? No, the state of disposition of the patients often chiefly determine the choice of the homeopathic remedy. The meaning of this can be beautifully illustrated through a case example. Let's read one case. A woman with leukoderma came to me with a history that she had had a dark complexion earlier. Then she went to America, where she spent 3 to 4 months. This was 11-year ago matter. In those 3 or 4 months, she did not know how, but the skin color started fading on both arms and legs and both sides of the face together. Slowly, over 2 or 3 months, all the color faded and she became absolutely white. There was not a single brown or spot on the body. When I saw her, she had been many skin specialists, and also after trying several therapy, they told her that her melanocyte had been completely destroyed and that she had no hope ever getting back to her normal skin color. They asked her to forget about it, since there was no treatment for this. She did forget about it, but after 9 years she develops a leukorrhea, which was very acrid and caused intense itching. She attempted to have the leukorrhea treated with the allopathic medicine, but without result. So she came to me for the treatment of her leukorrhea. When I asked her whether this was her normal color, she said, no doctor, but forgot about it, nothing can be done. So don't bother about treating skin. You only give me medicine for the leukorrhea. I explained to her the homeopathic approach and told her that our was a holistic treatment and that she might get her skin spot back. She said, well, it's good if I get them back. I told her that it may not be all the good, since she would be the spotted like a leopard. But she was a sensible lady and said, if it is going to make me well, I don't mind looking like a spotted leopard for some time. Then I began taking her case. I was asked her to tell me about her appetite, thirst, urine, stool, sleep, sweat, etc. But got nothing, no symptom. Damn it, absolutely nothing. Now, what should I be doing? Did get a few symptoms. Once was that she was a very warm-blooded patient. The second was that her leukorrhea was acrid and itchy. And that's all. She liked to take a long walk, and also she liked to take a long walk. There were the only 3 symptoms I had elicited, and after 1.5 to 2 hours of the questioning, my page were blank except for these 3 symptoms. What should I do? The pages were blank. My mind was blank. There was no remedy in my mind. I was asking her, tell me, are you irritable? And she said, sometimes. Are you anxious? No, nothing abnormal. But then I noticed something. I observed that the interview was going on very beautifully and I was enjoying it very much. It was very pleasant to be with this lady. She was very talkative, but nothing she said could be used as a symptom. But she was very expressive, and in her talk there was a lot of humor and joking. I asked her questions and she gave a humorous reply. I was laughing, she was laughing, my assistant was laughing, but there were no symptoms on the paper. I asked her, how is your sleep? She said, sometimes it gets disturbed. I said, what time? Around 2 in the morning, I wake up sometime and I don't go back to the sleep for 1 or 2 hours. Then I ask, what do you do at that time? Oh doctor, what can I do? I sit and talk with the talk with the God. In fact, we have a very pleasant conversation. So I said to her, don't you think it is very wrong on your part to disturb God at these odd hours? Look at the answer which came quickly and spontaneously. She said, Doctor, you have got it all wrong. I think when God doesn't sleep, He wakes me up to keep Him company. This interview was going beautifully, but no symptom. What should I do? Now, under the label, perceive the state of mind. And then suddenly I got it. She was expressing the most beautiful symptom of her case, and that was loquacity with jesting. In synthetic repertory, it's mentioned. So I took these two symptoms, loquacity with jesting, and then added the symptom acrid leucorrhea, hot passion and desire for motion in the open air. From this, you come to remedy Kali Ayurveda, and you can be sure of your prescription. Absolutely sure. I also found in Fatak repertory that Kali Ayurveda is listed in the rubric of symmetrical affection. Loquacity with jesting is one of the facets of the state of the mind produced by Kali Ayurveda. If you refer to the particular symptom, skin discoloration, white spot in the Kant repertory, you will find that Kali Ayurveda is missing. That is the point I want to emphasize. If you start with the rubric, you will certainly miss Kali Ayurveda. That is why Hahnemann's right. This hold true to such an extent that the state of disposition of the patient often chiefly determine the choice of homeopathic remedy. Now, under the label, the first principle supported by practice. So, the first principle that we derive from this case is a remedy that covers the mental state and general symptom of the patient has got a greater possibility of curing than the one that covers the particulars. This is the one of the reason I have learned from the practice. In my so many cases, I have prescribed on mentals and journals, missing the particular symptom in the repertory, and I have been successful. But when I tried this reverse, I have always failed. In the follow-up of these cases, progressive changes in her skin could be seen, and slowly the skin color was bilaterally symmetrically coming back. Now, second case. Another good case example comes from the Dr. Jayesh Shah. It was a case of swelling of the thyroid gland, which was extremely painful. It had come up acutely, and they had done the blood test and found that it was an autoimmune thyroiditis, means Hashimoto's disease. It is very difficult to treat and is an acute condition. The patient came to him for a first time, and she wrote down the symptom. Because it was so painful, she could not speak. She wrote, I am not able to swallow. It pained me very, very much in the thyroid. So he opened the repertory. External throat, goiter, painful swelling. On look at this beautiful symptom, he found there only one medicine, that is Spongia tosta, and he said, wonderful, what else can I ask? Kant has given me a gift. He gave Spongia tosta 200 and felt sure of his prescription. The next day the patients came back and she wrote, previously I could spit the saliva out, but now I cannot even do that. It is so painful. It has a double in intensity. The pain, absolutely no relief. And then Dr. Jayesh Shah suddenly realized that what she was expressing was aggravation from list motion. When you swallow, the thyroid move up and down. So when she swallow, the thyroid move. When she spit out or spoke, the thyroid shook. The slightest motion, list motion, any motion caused not mere pain but intense pain. The least motion caused intense pain. This expression is not to be found in the Spongia tosta. This is not the generality of the Spongia tosta. So Spongia tosta has a goiter, painful on swallowing. But when the patient says, When I move that part a little bit, it causes such an intense pain that is not the expression of spongia. This modality is met with the Bryannia alba. He gave Bryannia, and within a 24 hours there was a dramatic improvement. Bryannia totally missing in the rubric goiter in the Kant repertory. The remedy that covers the particular symptoms without covering the general symptom does not cure. It does not act. Remember this remedy, Bryannia does not have merely aggravation from motion. If a patient has acute inflammation of his knee and he moves his little finger and the knee pains get worse, then it is the Bryannia. Any patient with an inflamed knee will tell you that when he moves, it has a pain. That is not Bryannia. We should know how to select the symptom. It is aggravation from any motion. Our teachers have described it like this. The patient with an inflamed knee is lying down on bed and the curtain is moving and shout, "Oh, stop this!" That is the extent of the aggravation from least motion in Bryannia. If the modality is found in any part of the body, it is only Bryannia in the whole materia medica and no other remedy, and of course why its spongia failed. This symptom was not particular symptom, it was a general modality of the Bryannia expressed in the goiter. Now another case, I will give you one more case. This is the case of 9-year-old. He came with a cough and it was a paroxysmal cough which he had for 4 months. I had given him Drosera, Cuprum metallicum and several other remedies, but they did not benefit him. What can homeopathy do when the indicated remedy fails? He has to look at the case again and prescribe. This is what I had been taught. When the indicated remedy fails, it was not indicated. Find the correct one and it will work. It was not told when the indicated remedy fails, give tuberculum or give sulfur. They did not advocate this escape route. They told us, break your head like a coconut and the case will open up. So that is what we do. I called the child to the clinic one day at around 8 p.m. after I had finished my practice and made him sit down. I told him that it was either me or him today and that he was not moving from this spot until I found the remedy. I observed him for 40 minutes and then suddenly I noticed a strange thing. The child was coughing in very peculiar manner. He would hold his side of his chair and every time he coughed, the knee would go up and the head go down. I opened the cough chapter in a Kant repertory trying to look up for this particular symptom and read from the first to last page since I did not know from where to look for it. Probably the whole chapter because it was not until the very last page that I found the rubric. Cough, violent, spasmodic, jerking of head forward and knee upward. The remedy that is mentioned is Theridion. Now I was not very sure about the Theridion. I asked his mother whether he coughed like that always. She said, always doctor. Even when he is lying down in his bed on his side, his body has just come together and during the cough double up, and it has been like this since the beginning. When the mother was telling me all this, her voice was quite loud and the child said to her, "Keep quiet, mother, I am getting vomiting sensation." I look up the second symptoms of nausea, noise from in the Kant repertory. There are only 2 remedies, Cocculus and Theridion, both in italics. I now had the courage to give Theridion 200 because it covered the generality of the case, the general modality of the case, and that was aggravation from noise, tremendous sensitivity to noise, so much that the cause nausea. Theridion cured the child within 24 hours remarkably, and I observed that child for 6 years and there was no more cough. To the very next child that came to me and coughed like that, I gave Theridion with a lot of confidence and failed miserably. The reason there was no sensitivity to noise or any other concomitant to indicate it. Now another subtitle, second principle, corollary to the first principle. So we may say, if a remedy covers the particular without covering the generals and mental, it is bound to fail. Most of you agree with me that the whole principle that I have given are not entirely novel. They have been emphasized by many masters of the homeopathy. Now, what is the explanation of these observations? The explanation is the key with which many doors of our philosophy can be opened and reduce the difference between the various approach and school of thoughts in the homeopathy. One of the principle of logic is the controversy arise out of ignorance. When there is knowledge, there is no quarrel, because truth is one. So in person who quarrels, there must be a ignorance. We will try to resolve the conflict between the various schools, and one explanations will resolve many of them. Now under the label, know what is curable in disease. In the third aphorism of the organon, Hahnemann describes something very fundamental. The third aphorism is perhaps one of the most important of the organon. He says, I am reading the third aphorism. If the physicians clearly perceive what is to be cured in disease, that is to say, in every individual case of disease, means knowledge of disease indication. If he clearly perceives what is curative in medicine, that is to say, in each individual, means knowledge of medicinal power. And if he knows how to adapt according to clearly defined principle, what is curative in medicines to what he has discovered to be undoubtedly morbid in the patient, so that recovery must ensure to adapt it as well as respect to the susceptibility of the medicines most appropriate according to its mode of actions to the case before him, means choice of remedy, the medicinal indications, as also in respect to the exact mode of preparation and quantity of the required, means proper dose and the proper period for the repeating of the dose. If finally he knows the obstacles to recovery in each case, it aware how to remove them so that the restoration may be permanent, and then he understands how to treat judicially and rationally, and he is true practitioner of the healing art. Get the meaning of it. If the physician clearly understand what is to be cured in disease, does this make sense? Disease have to be cured. Hahnemann write in first and second aphorism, the physician's high and only mission to restore the sick to health, to cure as it is termed. The highest ideal of cure is rapid, gentle, permanent restoration of the health, or removal or annihilations of the disease in its whole extent, in the shortest, most reliable and most harmless way, on easily comprehensible principle. Cure is removal of disease. So the disease has to be cured. Then why is the writing in the third aphorism, what is to be cured in the disease? I consider word in as being very important. The person who know what is to be cured in disease will succeed. I am stressing this point again and again because it needs to be stressed. If we have a clear concept of what is to be cured in disease, we will cure. If we don't, we will not cure. Step by step, we are going to use logic to try and find the answer to this question. The first is aphorism 116. Some symptoms are produced by the medicine more frequently, that is to say in many individuals, other more rarely or in a few persons, some only in very healthy bodies. This refers to the proving. When remedy is proved, it produces some symptoms which are common to all the provers, some symptoms which are symptom of the individual provers, This means that a drug, when given to the 100 poor, will develop some symptoms which are common to all of them and some which are common to 30 or 40%. And there will be some symptoms that only individual pools will produce. Now, which are those common